Welcome back to Health Made Simple. If you caught part 1, we fact-checked RFK Jr.'s comments on drug pricing at the same cabinet meeting. Well, he's back again, and this time it's Tylenol, Trump, and autism. Let's dive in.
And you should be getting bipartisan accolades on that. I'll say one other thing about Tylenol, only because of this. This morning before I came in here, somebody showed me a TikTok video of a pregnant woman at 8 months pregnant. She is an associate professor at the Columbia Medical School, and she is saying F Trump and gobbling Tylenol with her baby in her placenta. And the level of Trump derangement syndrome has now left political landscapes, and it is now in the realm of pathology. And a mother could overwhelm millions of years of maternal instinct to put her baby at risk. And
first, that TikTok doesn't exist. No verified clip, no professor at Columbia University, just internet myth meets political theater. If you've seen that video or know the link, please post that in the comment section. I just can't imagine any pregnant woman taking gobs of Tylenol while pregnant to make a point.
And all you have to do is look at the studies which you and I talked about. It's not dispositive that causes autism. It is so suggestive that anybody who takes this stuff during pregnancy, unless they have to, is irresponsible. There are 15 rodent studies. Every one of them shows if you give it to the mother, the babies, and particularly the male babies, have profound neurological and behavioral changes. There is a study from Johns Hopkins on cord blood where they divided women into 3 categories: those who had the least acetaminophen in their cord blood, and those who had the most. The ones with the most had 3.6 times the rate of autism in their children. The middle category had 2.2 times, so it's a dose-related response. And there are dozens of studies that show the countries that use the most have the highest level of autism.
Now about Tylenol and autism. Here's what the science actually says. Let's separate mice facts from mom facts. There are 15 rodent studies. They found neurological changes in baby mice, but mice aren't mini humans. They're hypotheses on 4 legs. A lot of times we do studies on animals before we do the study on humans. He also cites a Johns Hopkins cord blood study. True, it found an association, not a cause. Even the author said these results should not be interpreted as causal. As you know, correlation does not equal causation.
Cuba has the lowest level in the world of acetaminophen use, and it has the lowest autism rate in the world. So this is not dispositive. It is not proof. We're doing the studies to make the proof. But in the meantime, the precautionary principle should apply. And any mother who is taking this stuff during pregnancy just to get back at Donald Trump is doing something that is pathological. And we're seeing that across the board. I got a lot of other stuff to talk about, but I know we got a short time here. But thank you, Mr. President. You're making our country healthier again.
RFK Jr. says Cuba uses less Tylenol and has the lowest autism rate. Well, that sounds impressive, except there's no data set that tracks Tylenol use and autism globally. He just made that up.
Thank you, Bobby. Could you just say, for the record, state what the autism was, let's say, 20 years ago and what it is today?
In 1970, the largest epidemiological study in history was performed. 900,000 kids were looked at. They were looking for autism in Wisconsin children. They looked at every child in Wisconsin who was 8 years old. They found an autism rate of 0.7 per 10,000. So almost close to 1 in 20,000, less than 1 in 10,000. Today, the autism rates are nationally 1 in 31, but it's actually much worse than that because California, which has the best collection system, reports an autism rate of 1 in every 19 children, 1 in every 12.5 boys.
Yes, autism rates have risen, but mostly because we've changed how we define and diagnose autism. How are we going to measure something when it's not fully defined? And sometimes in science, we need to change or refine that definition. For example, it's kind of like mental health diagnosis. Years ago, hardly anyone was diagnosed with anxiety or depression. Not because people didn't have it, but because doctors weren't screening for it, and most people didn't talk about it. But once awareness and testing improved, the numbers went up. Same thing here. More awareness, more diagnosis, not necessarily more disease.
This is a national security issue. There is nothing more important, and I'm grateful to you, Mr. President, because you know the flack that you take for even talking about this issue. You've shown courage and you've shown leadership, and I can't thank you enough for letting me do this work.
Thank you.
Here's the medical reality. Tylenol or acetaminophen is still the safest pain reliever during pregnancy. That's according to the American College of Obstetricians and Gynecologists. So no, taking Tylenol while pregnant isn't political. You can disagree with Trump and manage your back pain responsibly. Let's keep science out of conspiracy TikToks. If you like evidence-based reality checks like this, hit that like, subscribe, and share, because keeping health made simple takes all of us. Thank you for watching. See you soon.